Hi, I'm Sarah. I'm a children's emergency medicine doctor in the UK in a busy children's hospital. I've noticed there's a lack of practical information about children and coronavirus. This video aims to answer questions we've been asked by parents and families. Coronavirus is actually a family of viruses, but what we're talking about is a new type of coronavirus affecting mainly your lungs, which means your breathing. Because it's a new type, not many people are protected from it yet because our bodies haven't had a chance to fight it. However, it can affect different people in different ways. This is a tough question. Symptoms vary a lot and are similar to many other viral infections. We've all heard about fever, cough and sore throat, but it can also cause diarrhoea, vomiting, tummy pain and loss of smell and taste. If you think your child has these symptoms and are doing well, they do not need to be brought into hospital and they don't need a test for coronavirus. Currently, the NHS is only testing children that are going to be kept in hospital because we should treat all viral infections the same during this time. Just care for them at home and act like they have it. It's important to keep your child hydrated and feeling comfortable. As long as they are sipping water or juice regularly, enough for them to be going for a wee at least twice in 24 hours, then they are probably drinking enough for now. Expect your child to be up and down and a bit off their food. They won't be their usual selves. If they have a fever, keep them in as few clothes as possible. This will help their temperature to come down. Give them paracetamol, just follow the instructions on the bottle. It is not recommended to give ibuprofen if you think your child has coronavirus. These symptoms will usually last for a few days before things start to get better. This is really tricky living in a family, but you want to try and stop the infection spreading to everyone else if you can. Keep your child with symptoms in a separate bedroom from others. Make sure they have their own towels and put their clothes and bedding together as it's removed to be washed. Some people have suggested putting it into a clean pillowcase and then you're not touching it yourself. Wash down frequently touched surfaces around the house using soap and water. These include door handles, light switches, screens and tables. Wash your hands whenever you've been in contact with your child. Pay particular attention when changing nappies or when they've been to the toilet. Coronavirus can live in poo for up to 4 weeks, so be extra careful when cleaning the bathroom. Throw nappies away immediately. If they are coughing, make sure they have some tissues and dispose of them after use. Don't leave them lying around because those tissues are full of the virus. Just to be clear, everybody stays at home and everyone keeps washing those hands. Just imagine a family of 4. Mum starts to show symptoms of coronavirus. She will now need to self-isolate for 7 days, but the whole family will need to isolate for 14 days because of her symptoms. After a few days, one of the children also begins to show symptoms. They now themselves have to isolate for 7 days. After 7 days of symptoms, mum's isolation ends. The child's will also end 7 days from when they got ill. Towards the end of the whole house's isolation, dad starts to show symptoms. He will now need to isolate from 7 days from this point. However, the child who has shown no symptoms within the family can finish their isolation after the original 14 days, which was when mum started with symptoms. Unfortunately, we don't know how long you could have the virus in your body for after you feel better, so it's important you follow this guide and still stay at home and social distance when you feel better again. Check the guidance on the government and NHS websites for up-to-date advice. So how are you going to know your child is poorly enough to seek medical help? Think, have you done everything you possibly could at home? Are they getting worse? If the answer is yes, and you're worried, speak to 111 or your GP. If your child is finding it hard to breathe or has difficulty being woken up, then this could be an emergency and you should ring 999. If your child does have to be admitted to hospital because of coronavirus, they will have to be seen and stay in a special isolation area. You will normally be kept with your child, but to minimise risks, there may be special precautions you have to take, and other visitors are unlikely to be allowed. Together, we can stop the spread of coronavirus so that health services can give the best care to those who really need it. Thanks for listening. Stay smiling. Please share this video and keep washing those hands.